Good evening. Welcome to Asia Society Hong Kong Center for episode 16 of the coronavirus update. And today we're going to talk about children in this equation and this very interesting development and the latest development. And we're really delighted that Asia Society Hong Kong can have Dr. Jeffrey Burns, Chief Critical Care and Chair of ICU Governance Committee, Boston Children's Hospital. Before we get to Dr. Burns, I will like to introduce, give you a context and then introduce Sandy Fenwick, Chief Executive Officer at Boston Children's Hospital, to get the formal program started. So just kind of a bit of a context. Today, June 2nd, 2020, the cases is now over 6 million worldwide. And in the US, it's about 1.8 million. And here in Hong Kong, the recent development, unfortunately, we've had a cluster of local transmissions that was discovered this weekend. And currently, I think there's been a spike in increase in about 4 cases today. So the number now for Hong Kong is at 1,088 with 4 new cases. And so we are with originally we were hoping social distancing rules would be lifted by the government, but because of the recent spread, current social distancing rules in Hong Kong will remain for another 2 weeks. And so with that, I wanted to kind of get the program started, and by introducing Sandy Fenwick, Chief Executive Officer of Boston Children's Hospital, where she leads a team of 20,000 staff. And Boston Children's is ranked the #1 pediatric hospital in the nation by the U.S. News and World Report, and is home to the world's largest pediatric research enterprise, and is a leading recipient of pediatric research funding from National Institute of Health. Among all the hospitals, it is the 4th leading recipient of NIH funding. Boston Children is the primary pediatric teaching hospital for Harvard Medical School. So on that, I want to welcome Sandy Fenwick. Sandy?
Thank you so much, Alice, and thank you so much, Asia Society, for hosting this session. I just would like to start and just acknowledge how much COVID-19 has changed all of our lives. So much here in Boston for certain, but also around the world. And I also would like to acknowledge some of the fallout that I think we're all facing, not only the changes in our lives, but within this country, some of the racial tensions and some of the new immigration rules. And I just want you to know at Boston Children's that we absolutely abhor these restrictions, this intolerance, this violence. And we have continued to say so, both to everyone who comes here, as well as to the rest of our country and the world. So on that note, I'd like to just give you a little bit of context about COVID-19 and how it has impacted Boston Children's. As you know, and you will hear from Dr. Jeffrey Burns, while children have not been affected as to the degree that the adults have, it certainly has impacted Boston Children's. And we have, and I will leave most of the specifics to Dr. Burns, who's been truly at what we say the sharp end or the firing line of all of this. But Boston Children's has deeply remained committed to its 4-part mission of care, research, education, and our community. When we had to approach this pandemic, we basically had to shutter a large portion of our clinical operation for the safety of our employees and, most importantly, our patients and families. We took down our ambulatory areas to virtually a trickle and moved almost everything to telemedicine, where we were doing about 20 per day. We're now doing 2,000 visits per day. And we have taken our ORs down to less than 20% of normal. But we continue to see children with all of the major complexities that we have, heart conditions and brain tumors and the like. And in addition, we've been caring for children with COVID-19. We've seen about, I think Dr. Burns will give you even better details, about 140 children who've tested positive, and they've come to our hospital for care. And we've also become the coordinating center for most of Massachusetts and New England, where the adults had to literally shut down their entire pediatric units and transfer their children to Boston Children's. And so we played a very important part on the clinical side. In addition, as I mentioned about education, and Dr. Burns will tell you some wonderful ways in which we've been sharing our knowledge at the very beginning, all the way through to today, where we have shared our expertise, our learnings, and have created wonderful collaborations, not just in this city, but also around the world. On the research side, again, where we had to shutter the majority of our research laboratories here at Children's. And as you heard, we have a very large research enterprise here. Many of our researchers pivoted their research and focused in various areas, basic science, all the way through to translational and clinical, as well as some of our health service research on truly understanding the virus. We have a precision vaccine center, and that program under Dr. Ofer Levy pivoted his work directly to trying to create a vaccine specifically for the most vulnerable. And because he focuses so much on a precision vaccine, and because children were less impacted, he flipped to look at the elderly. And he is working on a targeted vaccine specifically for the most vulnerable, the elderly. We have people studying immunology, the immunologic response to this COVID virus in children. We have people on the clinical side doing clinical trials, both in drugs that are on the market and trying to understand what other ones might be applicable to treatment. So every place along the spectrum of research, we have tried to understand and do something about this pandemic. The link to all of this has been collaboration. Collaboration inside Boston Children's, but also collaboration across the country here and worldwide, both on the research as well as on the care and the education side. While we also take care of many international patients, and many of them have had to be repatriated back to their countries, we continue to try and provide support and care to our patients everywhere. And that's something that we will continue to do until we reach, hopefully, some place of whatever our new normal is. And as we think about the most important thing that we're trying to do is understand this, respond to it, and then prepare. Prepare for what we can do in the short term around treatment, potentially a vaccine, also the learnings to protect our patients and our families and our staff, and then most importantly, to prepare, to potentially prepare for either a spike again, as you've heard about in Hong Kong with these little pockets, or hopefully not something even worse, either another pandemic or this one. So thank you so much for hosting us. I'm going to turn this over to Dr. Jeffrey Burns, who is truly one of the most extraordinary leaders here at Boston Children's. You heard he runs all of our ICUs, but he also is the founder of a platform called Open Pediatrics. And I hope he's going to tell you about that, because this has been the platform that has allowed us to communicate and collaborate worldwide. And so Dr. Burns, who is also head of our international program, I turn it over to you, a wonderful leader and colleague. Thank you. We're happy to answer questions at the end.
Thank you, Sandy.
Sandy, thank you for those kind words. And it's a privilege to be here this morning. I was telling Alice, Hong Kong is truly one of my favorite cities in the world, and there's nothing better than being in Victoria Harbor and looking back at the city. And I want to say, as Sandy said, that we're obviously in a very difficult turmoil throughout the world with everything that's going on. But there's one thing that we can collaborate across all borders, and that's on the care of a critically ill child. And so I want to give you kind of an insider's view on how we're thinking about COVID-19 in children and what this multi-system inflammatory syndrome is about. And if you don't mind, I'm going to share the screen and in a few slides, take you through COVID-19 in children and the multi-system inflammatory syndrome, and then have a dialogue and answer your questions. Alice and Sandy, I trust you can see my screen?
Yes.
Okay. So on behalf of my faculty position at Harvard Medical School and Boston Children's Hospital, I have no disclosures. And so let's walk through, how did the international community come together? And I want to tell you that story because it involves colleagues from across Asia and across the world. And then a little bit about COVID-19 in children and this multi-system inflammatory syndrome. So this international collaborative, you might think that the WHO or one of the CDCs pulled us all together, but it actually occurred in a very improbable way. On March 14th, I and my colleagues were emailing each other about the experience of children with COVID-19, and we realized that that was a very inefficient way to do collaboration. So I offered to host a Zoom conference that night. And I used this platform, Open Pediatrics. And so as Sandy said, this is used around the world. It's used in Hong Kong. It's used throughout China. We have many collaborators throughout Asia who use this. And so I was able to really contact all of my colleagues across 6 continents who use this platform. It's designed for clinicians who care for children. All the content is peer reviewed. And this is a very interactive digital platform that was created by a research team that I was able to form with colleagues from MIT who are experts in the latest learning technologies, and colleagues from the Harvard Graduate School of Education on how adults learn. And so we used this platform to activate this international collaborative. And I want to highlight the call that we had on March 18th. And at 17:45 our time, at 5:45 a.m. In China, we had a presentation from our colleagues in China. Robert Liu is the Chief of Pediatric Critical Care at the Fudan University Children's Hospital in Shanghai. And Soyun Chen is my colleague. She's the Chief of Critical Care at Beijing Children's Hospital. And what they were able to do was to give us insight into what happened to children in Wuhan. And by this time, this manuscript in the journal Pediatrics had appeared. But what the manuscript couldn't do was to tell us in real time, what is it that we should look out for? And what our colleagues in China gave us was really an insight that children who have active infection from SARS-CoV-2 do not present in the same way adults do. And in particular, they alerted us that children often present with abdominal complaints. And they also highlighted some of the unusual laboratory values that the children had. And sure enough, that turned out to be what we saw at all of the epicenters that followed that. Our colleagues in Bergamo said, it's exactly as our colleagues in China said. And so on, London, New York. The pattern that our colleagues in China described for us was the pattern we saw in children. And what is that pattern? Well, this is the largest study that came out of North America. I'm the senior author on this. This was published in JAMA Pediatrics now on May 11th. And what we found was, as I think most of you know by now, is that the good news is that children rarely become critically ill from COVID-19. And when they do become critically ill, they certainly manifest all of the signs and symptoms that adults do. But fortunately, they're able to get through this with less burden of disease than do adults. We also found that of the children in North America who were infected with COVID-19, 80% of them had a pre-existing chronic medical condition. And that also somewhat parallels the experience with adults. But I also want to highlight for you, as we highlighted in the manuscript, that we looked at the CDC data over the same time period for influenza. And from February 1st to April 28th, a total of 8 children in North America died of COVID-19. Over the same period, February 1, 2020 through April 28th, 81 children died from influenza. So that highlights several things. Number one, for reasons that are still not clear, children are remarkably resistant to COVID-19. And in fact, they certainly hold some of the key to understanding how to create a vaccine, and they hold some of the key on treatments that would benefit adults. If adults could fight off COVID-19 the way children could, we would not be suffering from this pandemic. The other thing it highlights, of course, however, is children are not able to fight off influenza in the same way. So you see here, children died of influenza 10 times more likely than from COVID-19 over the same time period. So that highlights the importance of children continuing to get health maintenance and vaccines, and especially an influenza vaccine. I also want to highlight that my colleague, Dr. Adrienne Randolph, is the principal investigator for the CDC-funded study in the United States that's looking at children with COVID-19. So she's enrolling now 800 children with COVID-19, or now also this multisystem inflammatory disorder. And what she's looking at is actually their immune profile to understand how their white cells and how their other antibodies, et cetera, are able to fight off COVID-19 is absolutely one of the most key questions in this pandemic. Well, what about this multisystem inflammatory syndrome? What is this? On April 27th, as you see here, the Royal College of Pediatricians posted this alert to physicians in the UK, saying that they were seeing the emergence of what they called a pediatric multisystem inflammatory syndrome. And basically, it was a syndrome where the children presented with prolonged fever, more than a day, in most cases, 3 to 5 days, with a fever greater than 38 degrees Celsius. And then varying degrees of rash, abdominal discomfort, diarrhea, and in general, looking very ill. This is not subtle. Parents have all the tools they need to spot this. Your child looks very ill, and your child has a prolonged fever. Well, they asked me to devote the next international collaborative to just this issue. And again, it's just so improbable that it formed this way, but the WHO, the US NIH, the US and the European CDC, et cetera, they are all listening because it's a real-time, what we call point prevalence. When they listen to this conference, they're able to get really a spot check around the world on what's happening and what our colleagues reported about what's happening. And on the call on May 2nd, this was the aha moment for the international community. So this followed by 5 days, the alert from the UK. And as I said, my British colleagues asked that we devote this entire session. So this is actually, this was the outline of what we did over roughly 70 minutes. And we heard from experts from across Europe on what they were seeing with this multisystem inflammatory syndrome, and then across the eastern seaboard of the United States. And in particular, we heard from Dr. Mike Levine, who's a professor at the Imperial College in London. And this was probably the aha moment for the international community. And he presented the initial data out of London with this multisystem inflammatory syndrome. And the key chart, the aha moment, was when he showed data that showed the rise and prevalence of COVID-19 in the general population in the UK, London and the surrounding communities. Then he showed the rise of this multisystem inflammatory syndrome. And its peak, of course, is much smaller because on the one hand, the prevalence of COVID-19 in the general population in the UK is in hundreds of thousands, whereas this is just a collection of now more than 100 cases. But the peak followed the peak in the general population by about 4 to 6 weeks. That is, this multisystem inflammatory syndrome in children was rising and appearing 4 to 6 weeks after the peak had occurred in the general population. That was an aha moment for the international community because we recognize what that is. That's called a post-viral syndrome. It's when it's separated from the initial primary infection by about 4 to 6 weeks. That's a clue that that's not primary infection from COVID-19. That's a clue that it's the child's immune system that's actually causing the multisystem inflammatory syndrome. We were asked to issue a statement after that, that international call on Saturday, the 2nd of May. And on that call, as I said, were colleagues from Hong Kong, China, Japan, South Korea, all throughout Asia, Singapore, et cetera. And so we, the panelists, were asked to issue a preceding statement, which we did. And I think almost 8 of the panelists were actually faculty from Boston Children's Hospital. And the following Monday, I heard from the WHO, the European and the US CDC, and they said, we heard you. We all were there. We understand. And we're going to act on this. And they did on Thursday, the 14th of May, and then Friday, the 15th of May. On the 14th of May, the European CDC and the US CDC issued their alerts to their clinician community. And then the next day, the WHO issued this worldwide alert. You will notice one thing. We don't all quite agree on exactly what to name it. And so in Europe, it's known as the Pediatric Inflammatory Multisystem Syndrome. In the US, it's known as the Multisystem Inflammatory Syndrome in children. And then, of course, the WHO has a slightly different variant. But the point is, it's a multisystem inflammatory syndrome. And again, its features are something that every parent will now know. And that is, my child looks very ill. My child looks like they have a bad case of influenza. They have a fever. And then they have some mixture of a rash or abdominal complaints, or not eating or drinking well, but it'll be very evident to you that your child is sick. And it doesn't come on quickly. By definition, the European CDC says that the fever should be for 3 days. The US CDC says the fever should be greater than 38 degrees centigrade for at least 24 hours. And then the WHO takes kind of a European position that the fever should be greater than 38 degrees centigrade for at least 3 days. The point I want to emphasize, however, is it's not sudden. A parent shouldn't fear, oh my gosh, I've only got an hour or 3 hours or 6 hours to recognize this, and if I don't, something dreadful will happen to my child. No, this will evolve over days, and you will certainly recognize it. And awareness is really what we've been trying to do since then. This is an op-ed that Sandy wrote in the Boston Globe that appeared on May 19th. And our job is to promote awareness, not just in our own community, but across the world as to what this syndrome is. But like COVID-19, the good news is that children are rarely becoming ill from this multi-system inflammatory syndrome. And like COVID-19 in children, fortunately, there's really, there have been deaths. In the United States, we now think maybe 6 deaths from this multi-system inflammatory syndrome. However, it's so important to emphasize that it's still fundamentally rare. In the state of New York, where we had the largest outbreak of COVID-19, as I think you all know, it's not surprising, if this is a post-viral syndrome, that New York has seen more children with multisystem inflammatory syndrome because of that. But it's important to remember, although there have been 3 deaths from children in the state of New York from this multisystem inflammatory syndrome, it's very important to remember that there are some 4 million children under the age of 14 in the state of New York. And almost all of them are coming through this pandemic untouched. And that's one of the few bright spots in this just terrible ordeal. So I'm going to stop there. I'll leave this up while we move into now a dialogue. But if you have further questions, certainly reach out to our colleague Ben Zoll, and his email is listed there on the screen. But Alice, I'll turn this back to you.
Great. Thank you. Thank you, Dr. Burns. That was very, very enlightening, and also hopeful. What you mentioned, the 4 million under age 14, I think, and also the minimal number of deaths. So it's great. And you talked about collaboration. So can you talk about, my understanding is at the end of April, Boston Children's Hospital launched a study of COVID-19 among children and youth up to the age of 25 across the U.S. With 2 million funding from US CDC. Can you tell us more about this study and what is the goal and what is kind of the timeline?
Yes, and so that is the study that I referred to earlier, the CDC-sponsored study led by my colleague, Dr. Adrienne Randolph. And what she is an expert in actually in influenza in children and now COVID-19. So for the last 6 years, the CDC has been sponsoring her to examine the effectiveness of influenza vaccine in children. And so she had a network of approximately 25 to 30 children's hospitals across the US where she's been examining the immune response really to influenza vaccine in children. And so it was a natural transition for her and for the CDC to say, okay, keep your influenza vaccine network up and running, but can you also now convert over to a study of COVID-19 in children? And so what she's doing is she's enrolling children who are testing positive for COVID-19. Now, importantly, the goal is to enroll 800 children, but frankly, there aren't 800 children critically ill from COVID-19 in the United States, which is wonderful. Mm-hmm. But nevertheless, as we talked about, understanding the immune response is more important really than anything. And so whether they're critically ill or not, if they're positive for SARS-CoV-2 virus, but they're otherwise well, that's exactly the kind of child that you want to understand and ask permission for the parents to examine some laboratory values in that child, but in particular, how is it that they're able to fight off this virus? And so that study is up and running. And then when this multi-system inflammatory syndrome came along, it was a natural for the CDC to say, can she also, will she enroll patients and study that? So now she's enrolling patients with both COVID-19, children with COVID-19 testing positive, and she's enrolling children who have this multi-system inflammatory syndrome.
Great. And one of the questions that I was curious is if a child exhibit like COVID-19 symptoms, and there was a lot of fear here that does a family member usually get infected? I mean, kind of like flu. Usually, kids get the flu bug and pass it on to parents or grandparents and so on. So is that something that a family member should be worried about? Are the children more susceptible to COVID-19 as a spreader of the virus than adults?
It's unclear whether children shed the virus more than adults do. But what would be a concern, and so for instance, if you go to the US CDC web pages on this, they do highlight that if a child is living in a house with relatives older than the age of 65, and in particular relatives older than the age of 65 who are ill with perhaps a chronic illness, then extra precautions should be taken. And this is some of the balance about reopening schools. And there's no right or wrong answer here. It's like everything with this illness, it's a balance. But clearly, you would want to identify children who may be living in the same household with a relative who's over the age of 65 and that relative has chronic illnesses. And then you'd have to say, well, should we do remote learning with this child for a while, as opposed to sending them off to school every single day? And the concern would be that, are they going to bring something back into the house?
So yes, that is a really good point, because most of the schools, including here in Hong Kong, have resumed, and I understand in London, in UK as well. So I think that is a concern among a lot of people about is it too early? But you're right about everything with this is balance. The kind of the suppression and lift as we've heard before. And I remember when we started this webcast, February 14th, Dr. Ben Cowling from Hong Kong U was also very interested to hear the study of the role of children in the spread of this COVID-19. And it's really wonderful to hear these great collaborations. And it sounds like the collaboration that you talked about, this global collaboration, was started, organic. It wasn't started by WHO but it's, very much initiative from where you are sitting. But one of the question, I guess this is more of a political question, with President Trump's withdrawal from WHO that he announced last Friday. Do you think that's going to impact, collaborations in any ways with, what you are doing and what others are doing?
With our collaboration, it will not. As I said earlier, we're certainly part of the larger world, but all of us who care for children around the world, and this begins with my terrific boss, Sandy Fenwick, and the way she leads Boston Children's Hospital. Our job is to focus on the care and health of children, no matter where they are. And so if they're in our hospital, we're going to do our best no matter who you are or where you're from. But we also, as we've described, we have an international presence, and we believe that we can learn from each other. I gave you the example of how that call in March, our colleagues in China really helped send the signal that they wanted to emphasize children don't present the same way. You must look for abdominal symptoms as well and think about COVID-19. And what they told us, as I said, turned out to be true. And so nothing crosses borders, as I said earlier, in my experience. We don't agree on food or water rights, but we cross borders of all kinds to share knowledge about the care of an ill child. And boy, the world's in a really tough spot when we can't do that.
Well, you have a good point. I mean, this pandemic, this COVID-19 certainly knows no borders. So it's wonderful to hear the collaboration also knows no borders. And can you also talk about, you mentioned that initially in your presentation that you also heard from statistics as some information from colleagues in China. And maybe because there has been that much published about the COVID, and I think the numbers we've been looking at has been about China's lockdown and China's numbers. So we haven't heard that much about some of the earlier findings. I wonder if you can share some of the information that you might have heard from your Chinese colleagues about COVID and children affecting.
Well, as they said, they had published that paper in Pediatrics, but what you can't get from a manuscript is what you can get when you hear a colleague describe. And in particular, the paper noted the pattern that we've been talking about, that surprisingly very few children in Wuhan became ill and needed to come into the hospital, and even fewer children needed to go into the intensive care unit, and even fewer children needed to go on to life-sustaining treatments such as mechanical ventilation. However, what they were able to emphasize to us, as I said, was how they treated the handful of children who did become critically ill, what their problems were, how they treated them. And as I said, they highlighted for us and they showed us their inflammatory response. These are laboratory values of markers of inflammation. And they emphasized that the pattern that the children had was a little different than the pattern that adults had. And by their emphasis of what they saw, how they treated it, and what we should look out for, they gave us a head start, as it were, to understand what we should be looking for. And as I said, sure enough, our colleagues, the next place we unfortunately went was to Northern Italy. And we would hear from our colleagues in Northern Italy. And what did they say right away? They said, this is exactly, we're finding the same thing that our colleagues found in Wuhan. And that is, even though we're in the midst of this terrible outbreak of COVID-19, children, we only have a handful of children who are very ill in the ICU, but they're having the same presentation that our colleagues in Wuhan said. And so, as I said, they gave us a kind of a head start to understand what to look for, what to prepare for, and what to be vigilant for. And that has been helpful at each of the epicenters that's followed.
You mentioned now that, with schools going back, many of the schools opening, is there anything that you would be looking for in terms of kind of trends and so on with the return of school opening? Any particular signs that you would be looking for with either COVID or the multisystem inflammatory syndrome?
I'll give you two answers to that. I'll give you the first answer, then I'm going to turn to Sandy for the second part, because what I can speak to is the illness part, but Sandy has the larger view of our institution, because some of the balance here is both the psychological stress of children, but also the learning stress. So we have, the loss of learning and the role of media. So we have a number of programs across the hospital that are seeing another aspect to this that I'll turn to Sandy for. But, narrowly, I think we will all see together if there is an outbreak of COVID-19 in a community, there's suddenly a big spike. Then, of course, it's a threat to all of the adults. And so in terms of school, there's two threats. We've talked about one, and that's the child coming home and older relatives in the home or friends. But the other threat, of course, is to teachers. And so, you have to protect the school staff as well. And so can that be done safely? Do we expect the multisystem inflammatory syndrome to increase? No, as we described, it will trail the outbreak of COVID-19 in the community. There's a big outbreak in a certain community like New York State, then we would expect that New York State will see more multisystem inflammatory syndrome in children than other states. And that's the pattern. Fortunately, we're coming out of a terrible situation here in Massachusetts, as Sandy noted. And sure enough, we predicted that we would see an increase in multisystem inflammatory syndrome, and we did over the last 2 to 3 weeks. And now we expect it to go down, and it is. And I don't expect it to come back unless COVID-19 and the general population comes back. But Sandy, I need to turn to you because you have this broad view, because some of the balancing factors here are, psychological stress on children from not seeing their playmates and the loss of learning, and the media, how to use media and how not to overuse media, that we have these programs, Michael Rich, et cetera. Your thoughts?
Thanks, Jeff. So we have been here at Boston Children's advising both the state here in Massachusetts, because each one of our areas, each one of our states have been so differentially impacted by this virus. Boston Children's, is at sort of the epicenter. Massachusetts has been about the third largest and third most significantly impacted state in the United States. And so we have been advising at Boston Children's our leaders in the government about not only school opening, but at the moment, since we're approaching sort of the end of the school year, what do we do about daycare? Daycare is so fundamental to opening the rest of the economy that really was the first thing we started to work with our Commissioner of Early Education and Childcare. Because that really, we have 8,000 just in our state of Massachusetts, daycare providers, and both for our own staff to be able to come back to work, but also for everyone who depends on having an opportunity to have care for their children in these centers. This has been a real challenge. And so we have been working with our state, and yesterday they released what we call the minimum standards for health and safety for opening of daycare centers. That has also been applied to summer camps and programs for children during the summer. The schools have decided not to reopen until the fall. And so we are giving a distance between now and September, with returning to what will we do in the late summer to decide whether we reopen. But right now, as I said, the biggest issues are these programs for children during the summer. We've been working with them around we have our own daycare center. And so how do you maintain a facility, a safe facility? How do you screen children? Do you do temperature screening? Do you do symptom checking? Do the children wear masks? Do the staff wear masks? What do they do about hand washing? and what do they do about cleanliness of the facility. So all of those things, most of the requirements that are coming out are going to require, just as the hospital has had to do in Massachusetts, to confirm that they are complying with all of these standards, to send in what they call an attestation statement to the state before they will be allowed to open. So we assume that that's going to be the same thing that's going to happen with the schools. It's true for the day camps and even the overnight camps that we have in this country. And that's really what we've been doing. There is great concern not only for parents, who many of whom have two parents who work, but also for the concern that children truly need to get out of their very restricted environments right now, especially for children who live in multi-generational housing, to some extent in some degree of poverty. Those are the kids that we are the most concerned about. We've also been advising them on what to look for, not just clinically, as Dr. Burns said, not just to look for the actual virus or the impact of the virus, but we're starting to see a growing concern about children's emotional, behavioral, and mental health issues. And we're now at Boston Children's seeing an uptick on children coming through our own hospital with an exacerbation of both underlying mental health and behavioral health issues, as well as new issues that have been confronted with isolation and fear and the concerns about lack of learning and lack of sort of standard approaches. Sorry, my ambulance is in the background. And I think that is really something that we also have to ensure that our daycare workers, our teachers, and everyone who really is working with these children are on the lookout for. So we have developed both some training modules through our program called Children's Hospital Neighborhood Partnership, where we can actually provide online learning that will help some of these both daycare providers as well as teachers think about what they need to do to ease these children back in and to monitor them for a whole host of other kinds of things that they should be monitoring.
Thank you, Sandy. That's really, I have no children, but here in Hong Kong, my colleagues who have children, school has been closed since Chinese New Year in January. And, you know, the frustration and the mental health issues of the kids and the parents are something that we are keenly aware. And it sounds like it's with this no end in sight until the vaccine. This is something we also have to live with for the foreseeable future. But right now, we're going to take some questions from our online audience about, and in fact, those of you who are interested in submitting more questions on Slido, www.slido.com, on a rolling basis. The code is hashtag 6830, hashtag 6830. And here are some of the questions that have already came through. In regards to your research, Dr. Burns, into COVID-19 impact on children, what do you hope to uncover or see happens in the next month until the end of the year?
Well, this is going to sound paradoxical, but in some respects, there's a race to make sure that we can enroll children because fortunately, as the pandemic gets under control in certain areas, the window for us to examine, especially the multi-system inflammatory syndrome, is relatively narrow. The good news is it should go away, the multi-system inflammatory syndrome, or significantly diminish as the prevalence of COVID-19 in the population diminishes. And so it's kind of paradoxical, but there's a need to study this right now to understand. And regarding the multi-system inflammatory syndrome first, that is, as I said, children hold the key both when they're infected with the SARS-CoV-2 virus and they're able to fight it off, to understand how can they do that, and children hold the key to understand why is it that some of the elements of their inflammatory syndrome, their system, are really overacting. The immune response is accelerated in these children with the multisystem inflammatory syndrome. So we're trying to, it's almost two sides of a pendulum. On the one hand, we want to understand why can they fight this off so successfully. If we could understand that, it's the key to treatment and vaccine. On the other hand, why is their immune response overacting? And finding that balance and finding out what's tipping the balance, it turns out paradoxically is probably one of the major keys that the entire world needs to understand in order to overcome COVID-19.
Okay, and this other question from Jeremy, it asks, what procedures does the hospital have to balance the need for parental accessibility and exposure concerns to children with COVID-19?
Oh, what a wonderful question.
Yeah, very good.
I'm going to start, but Sandy, then you're
Oh, you go right ahead.
In the early part of the pandemic here in Massachusetts and the United States, we were operating under the assumption that we didn't have to wear masks unless somebody was symptomatic. And so we've always screened parents well before COVID-19 when they come into the hospital. And we asked them, is anyone ill with a communicable disease? This was probably more for influenza than anything else. So we've always had a screening procedure, and I think parents have always appreciated that we were careful. Because if we're careful for their child, then they know we'll be careful for all children. And so we were able to continue that screening process. But then once we went to masks, the parents, of course, were wearing masks as we are wearing masks. And I think that brought another element of I think everyone feeling even better that we were trying to isolate the community and what's going on out there from what's happening in the hospital. Now, what the balance is that, traditionally the children's hospital, you have not just, the parent or two parents at the bed space, but often, a grandmother or a grandfather wants to visit, and that's appropriate. And so then the question becomes, how many people should you have in the room and how can you control that? And so there we've had to develop policies where we probably can't have as many people in the room as we used to for the obvious reason. Even if you're wearing a mask, it's increasing the chances that virus could be spreading. And so we've narrowed it down to that. But for certain, we bring children into the ICU, parents into the ICU. And of course, even if their child has COVID-19, unlike some of the tragic stories we're hearing about adults, where they're in a COVID unit and you simply can't be bringing in a lot of people. At children's hospitals, and certainly our hospital, perhaps probably because we don't have so many children with COVID-19, we're able to bring their parent right into the room. And what we have to do is make sure that we protect them from the virus. And so we still have the parents coming into the room. Sandy, I don't know if you want to comment on the other aspects of it throughout the institution.
Sure. So we are just beginning to open up as of this week. Most of our clinics and are increasing our operating room activity because everything had to be basically shut down to a very limited place. So we have had to put a whole series of protocols in place from the very front door, where when families come, they are screened at the front desk by a series of nurses who ask about symptoms. At the moment, we haven't done temperature screening, and we've gone back and forth as to whether that really is useful or not. We require that every parent and child wear a mask when they come in for their visit, their appointment, or their admission. We then have restructured almost all of our physical plant to allow for social distancing. So we have reconfigured our waiting rooms with plexiglass, with tape to direct people, just like the stores have done so. And we have actually now allowed for 6 feet of different distance with in the waiting rooms, whether you're waiting for a child in surgery or you're waiting in a waiting room to go into a clinic. All of those spaces have been very well distanced and marked off with plexiglass between parents and each other. Hand washing and hand sanitizers are literally everywhere. And we encourage everyone as they move from place to place to do so. And we've been communicating all of this as we opened really yesterday on Monday. I actually did a video. Jeff, you haven't seen it yet, but I've done a video welcoming our patients and families back. And the most important thing we keep talking about is safety. Your safety, your child's safety, and of course our own. Continue to treat our patients and families. So we've done a lot in this area, trying to be very mindful that this is probably going to be a way of life for us, at least for the foreseeable future.
Unfortunately so. I hope, vaccine is found soon. But in the meantime, I think you're right, Sandy. It is something we have to. Plexiglass is the new thing. We've seen it around here in Hong Kong at restaurants and gyms, all popped up in this last couple of weeks, and I think it's going away anytime soon. But here's a question from Daniel asking, what is the first thing that I should do if my child shows COVID-19 like symptoms?
Well, here's what you will see, whether it's COVID-19 or the multi-system inflammatory syndrome. Your child will have a fever. That'll be probably the first and most constant thing that you will notice. The child has a fever. The second thing would be, does your child have difficulty breathing or abdominal pain or discomfort? Which is, as I've said several times, which is a little different than the typical trajectory for an adult, which is fever, respiratory distress, difficulty breathing, shortness of breath. Children don't always follow that trajectory. They sometimes have fever and abdominal discomfort. And as I said, whether it's COVID-19 or whether it's multi-system inflammatory syndrome, parents have all the tools that they need because your child will look very ill. It won't be that your child seems to have a runny nose. It'll be apparent to you that that your child looks very ill, and it won't come on quickly. As I said, it won't come on in 6 hours. It'll be something that emerges over a day or more, whether it's COVID-19 or whether it's a multi-system inflammatory syndrome. But I also have to emphasize this, as we've discussed, across the world, the number of children who've needed mechanical ventilation and life-sustaining treatment in an ICU for COVID-19 or multi-system inflammatory disorder is probably less than 200 across the world. And so the point is, if your child has a fever, it doesn't look well, call your pediatrician right away, as you always did, but they most likely have what would have caused a fever and not looking well in May of 2019. The odds are that if they're ill, they're ill from the things that cause fever and not looking well in Hong Kong in 2019, and so in Boston, that the odds are it's related to something like that. And pediatricians are expert at identifying what's the source of a fever in a child, especially a preschool child who can't really tell me a meticulous history. They're experts at trying to sort out what is this and what are all the other things that I've got to consider besides COVID-19 and multi-system inflammatory syndrome.
So this question is kind of related to what you just said. What do I do if my child has shortness of breath? Should I assume it's COVID-19?
Shortness of breath is a very unusual sign in a child. That would be a reason to have your child be seen right away. Now, I want to differentiate, and everyone knows their child best. It could be the child's short of breath for a lot of obvious reasons. They've been running around, or someone's focusing on it. Are you feeling short of breath? And so a preschool child or any adult might say, well, yeah, I do feel a little short of breath. But certainly if a child spontaneously says, I'm short of breath, or the parent notices that their breathing pattern is different, then that's a reason that the child should be seen right away.
And this question also from Emily, how do children who get the coronavirus react if they are on other medication like epinephrine?
again, the remarkable thing is, and when in our study in JAMA Pediatrics, as I said, we noted that 80% of the children who acquired the SARS-CoV infection and needed to come into the intensive care unit, 80% of them did have a chronic condition. But again, the good news is, fortunately, in our study, only 2 children did not survive. That all of the other children who came into the ICU were able to fight it off and were discharged from the ICU and did well. So again, unlike the adult experience, where if you have a comorbidity, it's called, the chronic condition, and you're older, those 2 combinations are associated with poor outcomes in adults. Whereas in children, while it's true that it may make them ill and they may need to come into the hospital or the ICU, the good news is, up to this point in the pandemic, even children with a chronic illness are able to fight it off.
These 2 questions are school opening related. In some countries, schools are now opening while cases are still on the rise. Is that too soon? And the other is related is, do you think schools should close if there's 1 case of COVID?
To the too soon question, I think we're all seeing this together. Around the world, we're seeing these natural experiments where people are trying all different kinds of combinations. And in that sense, as a physician scientist, it's the opportunity for us to all learn together, because there's probably no one single right way to do this. Regarding 1 child, that really depends on, and again, I think people would recognize that it depends on the environment. Is it a small school of just 5 kids, and and the teacher is an older person? Then you might behave a certain way. But if it's 1 child who's ill, but everyone else is healthy, you could imagine taking a different approach. That all these different experiments in reopening, as I said, are probably the best we can do right now across the world. There's probably no one system that's going to fit all.
Okay, and I think this is our last question. How closely are you currently working with the WHO, and who are other key partners?
We're working very closely with the WHO. I hear from them every few days. They are a very key partner. The US CDC is a very key partner. The US National Institutes of Health. I hear from them regularly. We set up conferences. My colleague, Dr. Randolph, is now taking most of this. We're focusing most of the efforts on her and the CDC study. But we intend to continue to work very closely with the WHO, and we intend to work very closely with colleagues across the world. We're learning from each other, and we're better together.
Well, perfect timing. I want to thank Dr. Burns and Sandy for both of you joining us from Boston Children's Hospital. And it's really, you've both shed light on some really interesting, some concerns, especially from the parents, and something that we've been hearing a lot about. And now we feel, I think, a lot more positive in terms of being able to handle if a child is diagnosed possibly with COVID. But it does sounds like, from the positive side of it, the number hasn't been that large as opposed to the overall, the other numbers. And we hope best of luck to Dr. Burns on your research, and we want to thank you. I think the information mentioned for the webcast, if you can would like to contact Dr. Burns, information would be happy to share the information that he has shared with us earlier. And I want to thank Sandy as well for your taking time from your busy morning, both of you, to be with us here in Hong Kong to talk about our update, coronavirus update. And we look forward to welcoming you both back in Hong Kong when we're clear to travel again. So thank you both. And stay tuned. Next week, we will have episode 17, when we will bring you Professor Peter Horby from the University of Oxford. He is Professor of Emerging Infectious Diseases and Global Health at the University of Oxford. And Peter is leading the largest clinical trial on COVID-related drugs. So please join us next Tuesday, 5 to 6 p.m. Hong Kong time. So again, thank you to our distinguished guest today, and thank you for joining us. And we look forward to seeing you next week. Thank you.
Alice, may I just say also thank you for everyone tuning in. A special thanks to Mr. Ronnie Chan, who's so graciously not only hosted us today, but also on previous occasions. And we also have a website, bostonchildrens.org, that has a subsection on COVID-19, and it has many, many subsections to answer even further many of your questions. So please, if that is useful, please go to that. Thank you so much, Alice, and good night, everyone.
Good night.
Thank you, Alice.
Thank you, Dr. Burns.